These kids and their families have one special thing in common. They're all helping one of Australia's biggest and most important research projects looking at the health of urban Aboriginal children.
My name is Darryl Wright. I'm a Dunghutti man from the north coast of New South Wales. We're one of 4 medical services that's been involved from the word go. We thought that the aim and objective would look at urban Aboriginal children's health conditions and then how can we improve those is what we wanted to do.
10 years ago, leaders from 4 communities across New South Wales joined forces with leading health researchers, the Aboriginal Health and Medical Research Council and the Sachs Institute. And that's how the Search Research Project was born.
I'm a Noongar from southwest WA, trained in medicine, and I'd just completed a PhD at the Institute for Child Health. So I thought, this is terrific. This is absolutely the way to go.
Search's success comes down to the fact that it is all about giving back to the community.
Search is special because it's being community-led, community-initiated, and the power lies there with the community. For example, we have an Aboriginal person as part of every research paper. There's a real respect for and a real valuing of the local Indigenous voice. Another thing that makes Search so special is it's working with Aboriginal children who are living in an urban environment. Search is the only research project of its type, following someone right through from when they're born and following them through to see what happens in health outcomes.
Researchers working in the Aboriginal Medical Services have spent time with over 1,600 kids and their families, getting information on every part of their lives.
How many serves of vegetables do you eat?
We have a lot of serves of vegetables. 45?
45 a week?
Oh, we have more than that.
More than that?
Yeah,
Okay.
so.
All of that information has been used to work out where things are going wrong and how to make a positive change in our community. It's connected housing to poor health outcomes and helped us talk to governments about the quality of the public housing in our communities. It's linked parents' mental health to how their kids are coping and helped us get funding for new programs. It's highlighted high rates of ear infection which can affect children's success at school. That's given us the proof we needed to make a change.
So Soraya, what we're going to do now is do an eardrum test. So all you have to do is stand nice and still, the machine's going to buzz and it'll be over and done with really quickly.
Just over the last 3 years through Search we've had what we call the HEALS program where we give kids with the hear problems operation. Before we found it difficult getting into the health system in the hospital. The data from the research proved that we needed some funds, so over those 3 years we've given about 160 kids operation.
Tre has been, he got grommets put in August. Before he had grommets put in, he was forever sitting in front of the TV, a little too close. The TV was so loud, it was actually ringing in my ears on a regular basis, so it was to a point where I took him to the doctors to see if just to get assessed to make sure that everything was a-okay, and they did advise me that his inner ear had not been developed, and they put him on a list of operation to get grommets put in his ears.
Got a lot of friends at school?
Yeah.
Since he's had them in, he's actually improved his hearing, and I'm quite pleased and happy about that.
So those kids are now have a new lifestyle because they can hear teachers at school, they can hear coaches and that sort of stuff. And we see the difference in the family when they come in now with those kids. And families come back and tell us, well, thank you.
All of this is possible because of the families who have been part of the Search program and who have opened up their lives to the researchers, benefiting not only our community, but hopefully others around Australia too, and making it possible for us to close the gap.
At RivMed, we have a few criteria for what research we will and won't support, and we get a lot of approaches and we say no to quite a bit. What we say yes to is to research that brings services to us. If it's just about taking data for someone else's paper, we're not that interested. Search, more than any other, has brought resources and helped bring resources to our community, to the service.
and it tells us that sometimes we might be going down, the medical said might be going down the right track with all the data that's come out. So it's telling us we need to move a bit, move out of the box and not be afraid of that, because the data is telling us that those are sort of things we need to do.
I'm really glad that search has been implemented into our Aboriginal community, just in a holistic view around health and helping our surrounding areas, so not just my children but other children in their community as well.
We all believe in self-determination, and that's really about Aboriginal people being involved in generating the solutions to the problems that confront us. And you can't do that and then take a solution to a community. You've got to do the work along the way with them to generate the knowledge and generate the solutions.